Hello and welcome to this episode of Drillin' and Fillin'. In this video, I'm going to replace this old silver amalgam filling in a tooth with a new one. I'm going to actually place a pin amalgam in this tooth because I picked this tooth because I believe this cusp on it is cracked. And so, there it goes. Yeah, I figured it was cracked. So now I will remove what's left of the silver filling and place a new silver filling. So let's clean it up. I just want to show you what the tooth looks like. So you can see where the cusp was. It's kind of that dark green, and it's a little greenish because I stored this tooth in some green Listerine, so it kind of stained it a little bit. There's the silver filling, and the white material underneath the silver filling is a base material. Dentists years ago used to place bases underneath their silver fillings. The idea was to insulate the nerve from the metal in the silver filling. So they would put a base, usually it was made out of either zinc phosphate cement or zinc eugenol cement. Just a little something to separate the silver filling from the tooth material. So nowadays I don't use that anymore. When I do place a silver filling, I just put the silver filling right up against the tooth, and tooth suffers no ill effects. So let me finish cleaning this tooth up and we'll get it ready for the pin amalgam. And so let me backtrack a little bit, explain what a pin amalgam is. A pin is basically just a little metal pin that was placed into the tooth to help hold the filling in. So this is what was used way back in the days before dentinal bonding was available. Because silver filling materials don't stick to the tooth, they have to be locked into the tooth, so you need to make undercuts when you drill the tooth. But when you're missing a corner of the tooth, like in a situation like this, there's sometimes not enough undercuts to help lock that filling material in. So the pin would be placed to help hold it in place. So we did this routinely on back teeth, on molars, premolars. I've even over the years have seen some patients that had front teeth, restored with composite resin, that the dentist at the time still placed a pin to help hold the composite resin filling. Nowadays, I can't remember. Other than this video, I have not placed a pin in probably close to 20 years, I'm going to guess. Just bonding agents have gotten so good that you don't really need to. There's even a bonding agent made by a company called, the company's name is Parkel, and the name of the bonding agent is Amalgabond. The idea is that you could use it to bond in silver amalgam fillings. That was popular for a bit when I was in dental school, but nowadays, again, we don't use that anymore. So here, now I'm placing just a pilot hole, and then those are the drills that I'm going to use. So it's just a really small drill that's the size of just slightly smaller than the diameter of the pin. So we just take it in the slow speed handpiece. I put it up against right where that pilot hole was, and I just make sure I got the angle correct, and I drill the pilot hole. The thing with pins is that you have to be very careful with that hole. So there's the pin. These are called minimum pins, and they just kind of shear off. That little drill's actually got 2 pins on there. So again, using my slow speed, just thread it into the hole and it snaps off, and there's the pin right where you need it. So the thing with these pins is that you want to make sure they're in the right spot. And there I'm just kind of bending the tip of the pin a little bit in just to make sure that the pin material is going to be within the silver filling. You want to drill the hole in such a location and orientation so that it's into the tooth, into a nice meaty part of the tooth on the corner where it can do the most work, but you also don't want to drill it into the nerve space of the tooth, and you also have to be careful not to drill it at an angle where the bottom of the pin will come out the side of the tooth. So once it's in and in place, as again I just bent it in place just to so that it's in the contours, then you just put a matrix band around it, and now we fill it up with silver filling material. And you just like placing a regular silver filling, you put it in increments using the amalgam carrier. And then now I'm just using various size amalgam condensers to kind of smush it into place. And you just add material, smush it into place to kind of lock it in, make sure it gets into all those nooks and crannies. Also want to make sure it gets around the pin as well, so that since the pin is what's going to help hold the silver filling in place. Now, why did we do big fillings like this? Why didn't we just, normally you break a corner of the tooth off. Nowadays, most dentists will just recommend having a crown placed on the tooth. Well, there was a point in time that, even not a point in time, even now though, crowns are expensive. They're one of the most expensive dental procedures you could have done. And so by placing large pin amalgams such as this, you can kind of get some more life out of the tooth without spending a ton of money, because this can be done all in one visit. Just numb the tooth up, remove what's the old filling, place the pin, place the silver filling, trim it, and person can chew on it. And these would actually last quite a long time, for years and years. Since amalgam fillings have kind of fallen out of favor, you could still do this with a large bonded composite resin filling without a pin, but they tend to be a little bit more difficult to do, and they don't last quite as long, especially as the silver fillings could. This is basically becoming a lost art nowadays. I know talking to dentists who were in the armed forces, in the military, it was very, very common for them to place very, very large pin retain amalgams on soldiers who were in active duty. Basically, they were, half the tooth was going to be filling, 3/4 of the tooth could have been big silver fillings. And they would work and actually last quite a while. Again, it's a little bit different skill set too than placing a white filling. This material, as you can see, it's a little soft when it's first dispensed. You can see I can easily put imprints in it with my condensers. So you got to build it up in layers. You actually have to overbuild it. So you want to add enough material so that it's up and above and around, higher than the sides of the tooth, and has a big shape to it. Then once it sets up a little bit, you go back and then you carve it. You trim it back down to get the proper shape of the final filling. So it's a little bit different technique compared to a composite resin filling. The composite resins, since you can you shape it till you're happy with it, and then zap it with a light to set. The silver filling's a little bit different. You actually have to, once it's in, it'll set on its own, but you have to wait to have it stiffen up a little bit before you start carving it. First instrument I'm using here, this is called an acorn carver, Christmas tree carver, acorn burnisher. It just helps me kind of rough in the grooves to get the right shape on the filling. And you can see the material is still a little soft. This isn't my normal brand of silver amalgam that I use. I like to use a brand called Permite when I do use it, and I like it because it sets up relatively quickly, and it's got a nice stiffness to it, so that it makes it carving very easy. This is when I went to order some more just to have in my office. The supply company was out of stock on it, but the sales rep told me, "Oh, we have this other material. It's just like it." Unfortunately, turns out it's not just like it. It takes much longer to set, even though this is labeled a fast set material. And for my taste, it's a little bit too soft, but we'll make it work. Again, it's not for a patient. But I did place an order for the Permite, and that should be coming in soon. So again, we're just trimming the filling back, cleaning it up a little bit. And so now, that last instrument after the Christmas tree carver was a Hollenbeck carver, and now I'm back to the Christmas tree carver just to get the grooves in a little bit. Makes it a little easier, quicker to do. And now I'm taking my spoon excavator just to round that corner off where the cusp used to be, just to give it the proper shape. So what I like to do is I try to do most of my shaping and trimming with the matrix band on, and then I'll remove the matrix band to get the final shape and contours. Again, as you can see, it's still a little bit too much material off to the side there because the matrix band, just the way it is, it just makes a round circle around the tooth. So again, we got to trim it back, just shaving the material off. So you need to you can still carve it as long as the amalgam hasn't set up completely. It will eventually get to a point where you can't carve it anymore. Can't carve it anymore with hand instruments, and you would actually need to use a drill to trim it down after that. But so you got to find that sweet spot where it's stiff enough to carve, and so you can carve it very well so it doesn't crumble, and just smooth it down. Here again, I'm just trimming the edges down around the sides. It'll actually, you'll get it once you get to that sweet spot of it's set enough, it'll actually squeak almost a little bit while you're doing this, and that's when you know. So again, you just want to make sure the bottom edges are flush with the tooth. You don't want to have any overhangs for where the filling meets the tooth, because those are all areas where plaque can collect, bacterial collect, and can lead to cavities in those situations. Also, you don't want to have any projections over top where the material is too thin. The silver filling material needs to be at a 90-degree butt joint with the edge of the tooth, just because of the nature of the material. Again, that's different than composite resin fillings, where the edge of a composite resin filling, the tooth, you'll actually put a bevel in it so you can feather the composite resin material into the tooth. So let's just clean up what's left of all the shavings, and pretty much I got the final shape done. So the last step I like to do, I just take a cotton roll with some water on it, damp cotton roll, and just kind of smooth it all down. And at this point, we'll check the bite on it. If everything's okay, send the patient home. And usually in dental school, they actually made us polish these. So at least 24 hours later, we'd have the patient come back and we'd polish the filling up with some brown, green point, greenstone, some brownies and greenies, and then finally some polish. Thank you guys so much for watching.